My name is Mark Bard. I'm the co-founder of the Digital Health Coalition. It's a nonprofit think tank focused on trying to foster innovation in the digital health and the digital pharmaceutical space. We're going to do a panel focused on kind of how do you close that gap between regulatory, compliance, legal concerns. So we're going to have a number of patients, patient advocates, e-patients as part of the conversations, talking about what are some practical solutions to close that gap, to kind of deliver solutions based on what patients want today. After attending the event for several years since the early days, it's really one of the few events where the patient is, as the name implies, at the center of the event. Concept is really, let's kind of put the patient at the center and figure out what are patients talking about, what is this entire movement around empowered consumer and this idea of e-patient, and we start to debate how technology fits in, what's the role of empowerment, what's the role of digital and technology, obviously. But it really is unique in that sense, I think, of trying to put that patient at the center, saying how can various parts of the system work together with the patient, as opposed to trying to force or tweak existing processes to make them work for the patient. If you ask you take a very simple question and look at this idea of, do you turn comments on when you do things in social media? Are you actually listening to what a consumer says today? And you hear a resounding no for the vast majority. And I think that's a really interesting fundamental disconnect as companies look and say, hey, we want to do this, we want to get involved, we want to get much more aggressive in this space. But some of these very fundamental issues around, are you willing to listen to what a patient or to what a community has to say? And we're not quite there yet with a lot of companies. The definition of social for a lot of companies is, we want to send a one-way message into this medium. And I think, as most of us know who do anything in social, it doesn't quite work that way. I think you have to look and say, what's the impact of people sharing information? And clearly, if you look at some of the examples of consumers sharing information with regard to clinical trials or new information that may be out there, or people trying to get on new therapies, or at least talk about what may be coming up soon, you can clearly make a connection back to public health. The fact that someone may not have been diagnosed with a rare disorder is able to come online and talk about their symptoms and post pictures and post conversations they've been having, and having a crowdsourced community come out there and start to give impact about, you may have this, or you may want to go to a physician, and we see the stories. Obviously can be a tremendous impact on public health is this idea of access to safety information, or access to just product education and information in general, where that tends to be a very locked down process, and we have certain reasons for why that is. But when you think about the potential for starting to open up this conversation, what if we have companies actively going out and seeking out adverse events or adverse experiences with a product? What if we have companies actively soliciting customer service requests in social platforms? I think then you change the dynamic, and we don't even really know what will happen, but I would argue that more of that free flow of information arguably can have a positive impact on public health, and we owe it to patients to start to figure out how that could work.